My name is Nicole Reno, and this is task number 21, Necropsy. So I have my poor patient here. This was a bird that someone, a Good Samaritan, found. The bird presented with neurologic signs. He was staggering, walking into walls. We kept him here in our hospital for a few days. We gave him supportive care. We tried to nurse him back to health. And unfortunately, we ended up euthanizing him. His quality of life was not great. He was not eating. He was not doing anything. So here he is now. On physical, just grossly looking at him, there are no wounds on him. I see no parasites, no sign of injury, no head injury, nothing like that. So first I have all my supplies. I have my blade. I'm using a 10 blade. I have thumb forceps. I have a blade holder. I have medicine balm scissors. I have some alcohol to wipe down his feathers so it's easier for me to obtain my samples. And I have 2 biopsy jars. So the veterinarian in charge of this case wanted some of his organs sampled. The Good Samaritan that brought him in actually was rehabbing birds, so she had other birds in her flock, so she wanted to make sure that the bird had nothing contagious. So first what I'm going to do is so now I know they're supposed to be in left lateral recumbency. With a bird, it's hard to cut them open that way. So what I'm first going to do is make the incision here, and then I'll put them in left lateral. So first, I like to tape down their legs and their wings. It makes it easier for me so that they are kept nice and flat and still. I'm sorry, little bird. And then I just spread their wings out like that. Again, just makes it easier for me to hold them. So I will place them in left lateral recumbency once I actually go in and obtain everything I need. Okay, so I'm just going to wet down his feathers, again, just so I have a easier access. So his chest does actually look bruised to me on physical here. So that is my first initial finding. So I'm going to open up my blade holder. Again, this is a necropsy, so this is not sterile. So you don't have to worry about being very sterile here. Okay, there's my blade. Just going to open up everything to have everything prepared here. Okay, now I'm ready. I'm just going to wet down the feathers a little more. Okay. So now with birds, they do only have one chest cavity. So for example, when there's something constricting their airways, or if they're having trouble breathing, it is difficult for them. It is difficult for them because they do not have 2 separate cavities, I should say. So I'm just going in here, I'm just cutting away some of the skin so I can break through the chest wall. Okay. So right away here, I have his intestines. You can see here. Just going to cut some out so you can see. This is part of his intestinal wall. Here are part of his intestines. To me, they look normal. They are nice and pink. They don't appear to have nodules on them. So there's that. my patient's liver, which is hard to cut out here. Okay. So now you want to be delicate when cutting the organs out too, because we are sampling them, so you want to make sure they stay whole. So here is part of my patient's liver. That is what we will be sampling. I know the doctor was concerned about it. Again, to me, it does look normal. It's nice and pink and red in color. I don't see anything abnormal about it. So there is that. Okay, here's another structure here. So this here is his spleen. It is very enlarged, actually. So it's also very hard. So I'm going to have the doctor take a look at that too. I think he'll want to have that sampled as well. So I'm just going to move my way up here and just going to look for the crop. Now the crop in birds is down there, their right side. Just go find more alcohol for the feathers. Let's see where I'm going here. So I'm just coming all the way up. And I see his crop here. His crop is actually empty. I could have told you that because I know that he was unfortunately not eating. Another thing that I just actually saw, are there a large amount of blood clots in here? There's a big one right here. Okay. Here's a pretty large blood clot. This is pretty large for the bird. Again, this could be a cause of death. A lot of patients do actually develop blood clots post-mortem, so that could be a reason as well. Here are the rest of his intestines. Right here. Okay, so now I'm just going to put my patient in left lateral recumbency. I know that was required on the task. Okay, I'm going to observe from this angle here. So I do not see anything else abnormal. The doctor said that it was not needed for me to go into his skull. He just wanted samples of the organs, so. Another piece of the liver. I'm actually just looking for the patient's heart, which I just found. So here's the patient's heart, or part of it. Heart looks normal, nice and red. There's a lot of blood flow actually coming out of it. There are a lot of blood clots around it. Again, that could be as a result of post-mortem. Okay. So next what I'm going to do is I'm going to put my samples into my biopsy jar once I am done. So here is my one jar. And I'm just going to place my liver in one. Again, these were the two that the doctor wanted samples. And my spleen. I am now just going to label these. So this is liver, and this is spleen. Okay. So now we are all done with our necropsy. So now what I'm going to do is package everything up, clean everything up, and then document everything in the record. So now that I've finished my necropsy, I'm just going to document everything that I saw. So this is our wildlife sheet. So I'm just going to write here avian date. So I'm just going to write on external exam. On external exam, nothing seen, no parasites, no wounds, presented, neurologic, okay? And then internally, intestines, liver, heart, WNL, or the normal limits, or normal color, normal weight. Then the spleen to me did seem enlarged, so enlarged spleen. A little pale, so pale in color. So here I'm documenting everything. Lastly, the intestines. His intestines were normal, and his crop was empty. Tissue in the crop did appear normal, tissue normal, but again, was empty. Sometimes it's easier to see if there's any damage in the crop when it's full. You can see the tissue and lining better. So then I'm just going to write down here biopsied. So these are the ones that we sampled. We're sampling the liver and the spleen. And we are all set with our necropsy.